The future of healthcare for me is a system that's very accessible to people when they need it, and also is extremely high quality. Originally, I came with an idea about medication tracking. So how can we help patients better manage their medications? And then I remember speaking to Will about it, and then he was like, I'm in. He didn't really know what the idea was.
We started back in 2017, I believe. And the reason why we worked on it is because we had an ambition that we wanted to help healthcare. We also saw that there were so many problems, and we could just see that technology was going to be such an important influence on society as a general.
I think at the time we were both really interested in technology and healthcare and the opportunity to work on something that was our own. And then along the way, and we realized that we knew nothing about building products. That's when Viz came into it.
There were two medic students that needed a designer. I kind of came into the mix just to give design advice. I just want to add as well that he actually did attempt to do design himself.
Yeah, we did.
But the reason I actually joined Suvera was because when you kind of saw them in the room working, the level of passion in that product, you wouldn't have seen that they actually didn't believe it was going to work. In terms of the idea and the trajectory it was going, I could 100% see the vision was quite clear where they wanted Suvera to go.
We didn't start off thinking it would be this big, this soon, but we did start off with the similar ambition, which is to bring together healthcare technology to be meaningful to people's lives.
At the time, there was a really big kind of scene in sort of health and technology that was just about growing. And you could see that there was these problems that are happening in healthcare, but you could see also there was innovation in all the other sectors, but healthcare hadn't really undergone that same change.
The mission at Suvera is to keep people in good health wherever they are. I would say the good health part came from an awareness that the system is very reactive. In that, if you have a problem, that's when you get access. Whereas we know there are things you can do before you have the problem to help improve people's health.
What I see Suvera get into is creating a service that not only creates something special, but also creates a blueprint for other healthcare companies to adopt and learn and build something of their own that's unique, because I feel it will have to be a lot more collaborative for us to create a better healthcare system.
The NHS has always been set up to look after people who need care at a point in time, but it was never set up to deal with the aging population, people living longer and having long-term conditions. So we see general practice being under a lot of pressure. So we exist really to support the NHS and to help them in order to look after more patients and to look after our population as well.
Very few healthcare providers are delivering care and changing it at the same time. We're doing both. Between delivering care, improving it, and then paying attention to that over time will no doubt, lead to compound returns for patients and the whole healthcare system.